Hi everybody, Adrian Melero from Miami Acupuncture Therapy with another video for you guys. And in today's video, we're going to talk about acupuncture for low back pain. Now, the majority of people who've never had acupuncture for low back pain, when you think about acupuncture for back pain, they just think about needles and maybe needles numbing the pain, which yes, it does help in the analgesic sense, but that's only like just a small part of the overall thing that acupuncture does, or what an acupuncturist can do for low back pain. And then in our office, there's 5 major components. Most acupuncturists is something similar, although we add like a couple extra things. And the first thing that acupuncture does that many people don't realize is that it brings down inflammation. Now, a lot of times, if there's a disc impingement, if, for example, you have like sciatic pain, there's radiating pain, the majority of the time, the bulging disc or herniated disc is not actually touching the nerve, but it's so near that it creates the inflammation around it. And usually that, more than anything, causes the pressure. So the acupuncture, among its other combined modalities, help bring down that inflammation. And then with that, at the same time, it also speeds up healing, because when you can disperse that inflammation, you speed up the healing time and makes things a little more efficient. So you can needle very locally. You know, you have like your standard protocol for needling, you know, like the bladder 25, 24, this little area here. And then you also have your distal points, which travel along channels that go to the back. So if you go like bladder 40, bladder 60 here, that's also effective too. Now, second component is that it speeds up healing, which it's also, just like I mentioned with the inflammation part, it helps speed up healing, especially when I include the microcurrent, which that's actually number 5. The third one is the scope in acupuncturist and acupuncture and oriental medicine in general is more than just needles. There's manual therapy. So for example, if the issue is not disc related, maybe if it's muscular, sometimes the quadratus, if you're doing like a lot of work, sometimes it's just tight. So sometimes there's certain manual therapies that you can do. However, if it's myofascial in nature and it's acute, there's certain manual therapies which might aggravate it. So it requires proper assessment. Now, if it's for bulging disc, one of the manual therapies that could be done, if it's done properly and in a way that's not going to damage the knee, you could do manual traction. Now, I know there's inversion tables, etc., but a practitioner, among all the other things that is being done in addition to the needles, usually traction will alleviate pressure on the disc by pulling the leg. Sometimes that alone will alleviate the pressure of the bulging disc. And a lot of times, like degenerative disc that's just pressing on stuff. Sometimes while chiropractic adjustment has its place and it has its benefits, sometimes when things are a little more acute and irritated, sometimes the best thing is, instead of like adding pressure or doing anything, just alleviating pressure just by creating space. So basically, like, you hold on to the leg, support the upper thigh for like the knee. By the way, only a trained professional should be doing this. You don't want to injure somebody by trying this at home. And then you just pull. It's a very gradual pull, but it's a strong pull, but done gradually so you don't affect the soft tissue. You're just creating space between bones, between the vertebra. Sometimes, now this is where assessment comes in, because it's more than just, okay, these are the points, these points will make the pain less, etc. You need to have a proper assessment, because the proper assessment is pretty much like 98% of resolving the issue, because everything else, at least I guess since we're so accustomed to having our protocols that are effective, like it's pretty much a matter of narrowing it down to exactly what's going on. So for example, the issue might not be so much in the lower back, but it could be a sacroiliac joint. And sometimes by doing a stretch that kind of helps align things, it can help align the sacroiliac joint and relieve impingement, because a misalignment of the sacroiliac joint a lot of times is what causes the impingement, and sometimes it causes irritation and tension of the piriformis muscle, which could also lead to sciatic pain and irritation of the nerve. So assessment is very important, and also if it's in fact sacroiliac syndrome, etc., then the manual therapy and the stretch, usually that's 90% of what will help it, and everything else is just bring down inflammation, just kind of like quicken the recovery. Number 4, the fourth modality is infrared. And even though in Western therapy, Western medicine, usually cold is recommended, and yes, cold will help bring down inflammation after some activity, etc. The infrared is different than a typical heat pad. Heat pad is moist, so for arthritic people, it's actually more aggravating. Infrared is like a dry heat, and it's a penetrating heat, and it's a little more unique than a heat pad. And I'm gonna make another video sometime in the future just on infrared, so be sure to subscribe and hit the bell button for updates on my different modalities. But the infrared will help disperse inflammation, which will in turn, as I mentioned earlier, speed up healing, etc. And for the patient, it's very comforting, that little heat, anything for achy joints, etc. Some practitioners, they use cupping to disperse the inflammation. It's not my personal preference to use it often, but it is effective as well. I like to use cupping for arthritic conditions, but for more acute stuff, I like to use my 5th, which is microcurrent. And if you could zoom in a little bit here. Microcurrent pads is different than TENS. Usually the typical therapeutic electric stim is the TENS, which it does help and it helps alleviate pain, but the TENS is in milliamp where you feel the muscles twitching, and it does help. But the microcurrent, when you make it with specific frequencies, for example 40 hertz, which is anti-inflammatory, the effects are exponentially better. And then you could put a frequency of 40 hertz anti-inflammatory, and then you could follow that up with 528 hertz, which is DNA repair, and the effects are extremely profound. I mean, my massage therapist here, sometimes I'll do the probes, I'll do the needles, and she'll insist on the microcurrent pads, because she says like when I don't use the microcurrent pads, she feels like the difference. Like she says the microcurrent pads just, it's as if like she never had like a full day of massages. So the microcurrent will help if it's like, for example, if it's not a disc issue, but it's like a muscle strain. With the muscle strain, the only real thing that you could do for that is, besides like the needles around it for the ashi points, is the microcurrent, which will speed up healing. Rest, because anytime you're using muscles that's torn, broken, frayed, or etc., you're just putting off like the healing time. So you need to be off it. And then, so definitely not chiropractic when you have like something acute muscular. What else? Another thing, with the microcurrent, we also use probes. And then with the probes, with microcurrent probes, you can stimulate acupuncture points as if you were using acupuncture needles. So for example, if I put the positive probe on the pain point and then a negative probe on a distal acupuncture point to send, the positive will reduce and then the negative will send. So I'll just put it here like this, and then it'll send a current, or I could just do it locally too, all around. So there are many different modalities. There's many different aspects to treating low back pain than just the needles alone. So wherever you are, if you have low back pain, don't hesitate to look for an acupuncturist in your area, because it's certainly a multi-pronged approach. And I believe out of all types of practitioners, it's probably the most multifaceted and multi-pronged treatment and therapy available for low back pain. So if you want like more, how should I say, more details about, there are more details about what we do as far as like the difference between TENS, microcurrent, specific procedures and modality, because I just kind of went over it generally. Make sure you subscribe and hit the bell button, and we'll see you in the next video.